Hi, yes, I am Hayden Zetter, and I will be doing a presentation on metastasis. There's kind of a lot to go over with metastasis, so I'm just going to kind of give the general description of how it works and what metastasis is. So, what is metastasis? Metastasis is the medical definition or term for cancer cells that spread to different regions of the body from where the original tumor had started, where it can start to form new tumors. There are a few ways doctors will refer to cancer that is metastasized. Some of these terms include stage 4 cancer and advanced cancer. It can also be referred to as locally advanced cancer because cancer doesn't always spread to different regions of the body, but to nearby tissues or lymph nodes if they are present. So I'll kind of just give a quick overview of metastasis. There's 3 steps involved. So the first step is the process of invasion. The second is intravasation, and the last is extravasation. And these 3 steps or phases are collectively known as the metastatic cascade. So the first step, invasion. At the origin of the tumor, the main goal for cancer cells is to work towards the ability to penetrate surrounding tissues. As the tumor starts to grow, there's a loss of cell-to-cell adhesion among cancer cells. And as the capacity increases, cells start to dissociate themselves from the original tumor. When this happens, tumor cells start to secrete substances to degrade the basement membrane and extracellular matrix of the tumor. And as these changes start to occur in the cell matrix, it allows the cancer cells to invade the surrounding supportive tissues, or what is known as the stroma. And this whole process is collectively known or is considered as invasion of cancer cells. The next step in the metastatic cascade is intravasation. So as invasion begins, the tumor must also initialize angiogenesis, or the development of new blood vessels to the tumor itself. Without this process, the tumor won't be able to survive, as only smaller tumors, like 2 millimeters in diameter or less, are able to survive without undergoing angiogenesis. So as these new blood vessels are developed, the vessels that are close in proximity to the tumor can be used for any detached cancer cells to enter the circulatory system and begin to spread to other regions in the body. And so this whole process is intravasation phase of the metastatic cascade, and it is also considered to be the most life-threatening stage for patients who suffer from cancer. In many cases, when people are diagnosed with cancer, the cancer has already begun to spread, hence why it is referred to as advanced or stage 4 cancer. So as cancer cells move throughout the body, there are many factors involved with the survival of cancer cells. So while they're on this journey to find a new site to start creating a new tumor, cancer cells can become damaged as they travel through tight passageways in our blood vessels, and they bump into other structures or other cells, and this can damage the cells, which can ultimately lead to the cell's death. Other cancer cells can be destroyed by our body's natural defenses, such as white blood cells or lymphocytes, that identify these cancer cells as foreign substances and destroy them. However, this does not stop the overall spread of cancer, as the original tumor continues to. So the last step, extravasation. So once a tumor cell's arrived at a point where it can start the process of intravasation, or the development of blood vessels, to help the tumor grow and develop, that angiogenesis. Tumor cells begin to interact, with the endothelium that they're near, within the blood vessel, by means of biochemical interactions. This process develops adhesion to the endothelial cells, which then form stronger bonds. And then when these bonds are formed, this helps tumor cells penetrate the endothelium and the basement membrane. And then this penetration of the endothelium is what is referred to as the extravasation phase of the metastatic cascade. Once established, the cancer cells within the tumor can repeat this process and continue to spread. So in review, the metastatic cascade is dependent on several events in order for this process to be successful. There must be invasion or loss of adhesion between cancer cells, um, which allows them to dissociate themselves from the original tumor and begin to degrade the basement membrane and extracellular matrix of that tumor. Intravasation must occur, which involves angiogenesis, or the development of new blood vessels, to one, ensure the tumor survival, and secondly, allow the cancer cells to enter the body's circulatory system and gain access to different regions of the body. Um, and finally, extravasation must take place, which means cancer cells must be able to survive the journey to the site and begin that interaction, by means of biochemical interactions with endothelium within the blood vessels, so that they can adhere to the endothelium and start to penetrate the basement membrane and begin this whole growth process all over and continue to spread throughout the body.